We formed a quorum. May I call the meeting to order? This is the meeting of the panel on education. Information papers issued since the last meeting. We have got 4. One from Dr. TIK Chi-yuen, letter dated the 6th of July, paper number CB4685/2021 and the administration's response to Dr. Tik's letter, and is paper number CB4685/2022 We've also got a letter dated the 15th of July from Mr. Dennis LEUNG concerning the improving the manpower at the middle management level and rationalizing salaries for school heads and deputy heads in public sector primary schools. Paper number CB474/2022 and the administration's written response to Mr. Leung's letter is in paper number CB4741/2022 Members may wish to read through these papers. Now we come to items for discussion at our next meeting, as well as the date. The next meeting is tentatively scheduled for the 4th of November at 10:45, a Friday. Another regular meeting will be scheduled for the 2nd of December 2022. For the November regular meeting, we will of course have the Secretary for Education's briefing on the Chief Executive's 2022 policy address in relation to educational policies. And the Education Bureau would also want us to discuss a paper on the creation of 2 supernumerary principal education officer posts at D1. So these are proposals from the administration. Members may also refer to paper CB4865/2022, and that is the list of outstanding items for discussion. Members may want to discuss recent incidents related to education. As chair of the Education Bureau, I have had many rounds of discussion with the administration. Hopefully, information papers can be provided for issues raised by members, and hopefully we can discuss them as well. So last month and also the beginning of this month have seen many suggestions from members, and I'd like to arrange for discussion of these items as soon as possible. And according to the administration, they may take some time to prepare some of the issues. We may have to wait until early next year. For instance, myself and a number of members would like to discuss the impact of a drop in population on admission of students at primary, secondary, and university levels, whether there is any plan and any short, medium, and long-term measures. This was raised in the Education Bureau Education panel last year. The panel had a discussion with the Education Bureau, and according to the Bureau, they would take a few months to compile the related statistics, but then there was an outbreak of the epidemic again in the beginning of this year. And then the administration wanted to focus all its efforts on its fight against the epidemic, and therefore we have yet to cover this item in this panel. I have discussed with the Secretary for Education, and hopefully at the first meeting of 2023, and no later than the second, statistics can be provided, because this item was first proposed in September 2021. We gave this order to the administration back then. Hopefully, after a few more months, they can get back to us in early 2023. I very much wanted to cover this item in end 2022, but then I have another suggestion. Recently, there was an incident involving a school for the mentally handicapped. I would like the panel to discuss that. But then, in November, we're going to cover the policy address. Of course, we can still put issues of concern to the Secretary. And preliminary, I have agreed with the Bureau that we will cover this suspected abuse of students in a special school in the December meeting. It's a matter close to the heart of many. So that's my report to you. I'd like to have your views, since you have made a number of suggestions for discussion. Now, if you have any view, please let us know, and each will have 1 or 2 minutes. Dr. Tick, thank you very much. On the impact of drop in population and brain drain, now there would be short, medium, and long-term impacts on our education system, and I very much hope that we can discuss this matter in the first meeting of 2022. Let us pressurize the administration, because I don't know what will be the implications if we are to stall further. And I'm sure there will be this item in the next policy address. Yes, this is something we cannot dodge, because this is a subject of concern for the whole city. And of course, coupled with that, there is also a decline in birth rate. So I will push the administration, and we should cover that in January or February, hopefully. I'll continue to follow up with this matter. Any other comments? All right, you're welcome to write to us. We have relayed your messages contained in your letter to the Education Bureau, always. So that's my communication with the Bureau on arrangement of meetings. Now we go into our agenda proper. If you have any views, feel free to contact me at any time. And the Deputy Chairman will also be willing to accept your views. Please invite Dr. Choi-yuen, Secretary for Education, to join us now. And the first item for our discussion today is anti-epidemic measures in the school sector. For members who intend to speak, press the request to speak button. Now, this is a very important issue. Each member will have 4 minutes first. Then, depending on the Secretary's reply, of course, I will allow follow-up. First, Dr. Choi, Secretary for Education, can you please introduce the paper to us? Thank you, Chair. The 2022-23 school year started smoothly in September this year, and we're grateful to schools for their efforts and cooperation in implementing anti-epidemic measures of the government. I would like to brief members on the arrangements and related anti-epidemic and support measures. The Education Bureau has always kept track of the development of the epidemic and has maintained close liaison with the school sector to strike a balance between student learning and epidemic prevention as far as practicable. In 2022-23 school year, all schools in Hong Kong have resumed face-to-face classes, which are currently conducted on a half-day basis until further notice. We agree that face-to-face classes and participation in extracurricular activities are very important to students' social, physical, and mental development. So as far as the epidemic situation allows, and we will progressively increase the duration of face-to-face class teaching and extracurricular activities. If schools can attain the required vaccination rate, we'll allow schools to arrange whole-day schooling. If primary and secondary students can achieve the vaccination requirements, schools can arrange for non-academic extracurricular activities during school time or after school, and they may allow to participate in some mass call activities. With the exception of exempted persons, all teaching and non-teaching staff, persons providing on-campus services, as well as visitors, including students who are aged 5 above entering the school in the capacity of visitors, must fulfill the vaccine pass requirements before entering school premises. And all students and staff are required to undergo RAT tests before returning to school every day. And schools will also distribute RAT kits to needy students, and we encourage students to be vaccinated as far as possible, and they should make use of the various arrangements made available by the administration so that we can have better protection for students. And then together with different district school head associations, school sponsoring bodies, and government departments and government-aided schools have been providing vaccination services for students, and we've also prepared APIs and online information on the development of the epidemic. And starting from September 2022, every month we have an online survey to collect the vaccination rates for teaching and school staff so as to promote further vaccination. And in this school year, we've also launched the School Vaccination Commendation Scheme to give recognition to students that have been vaccinated and to promote further vaccination. We have provided various support to students for learning and also for their emotional well-being. The schools are flexible in deploying various teaching modes, including e-learning, etc. We will continue to provide a variety of online resources. We have got telephone hotlines and also mobile apps, etc., to provide support to teachers as necessary. We have different measures to support needy students to carry out e-learning. We have issued internet access subsidies, and we will also have this subsidy scheme for schools to provide computers, etc., for needy students.
For cross-boundary students, we are very concerned about CBS students who cannot travel to Hong Kong to attend school. The schools, based on their own situation and the different needs of the students, will flexibly adopt diversified learning and teaching strategies, including establishing e-learning platforms and conducting real-time online lessons. In the 2023, we have launched a new round of psychosocial support programs to improve on those programs. And the EDB has always committed to provide additional training for teachers taking care of students with special educational needs. We are devising different online resources to help teachers to help SEN students. The EDB has attached great importance to nurture students happily. So we have adopted a whole school approach, and we have encouraged schools to cultivate positive attitudes among students. Starting from 2003, the EDB has been organizing My Pledge to Act annually to encourage schools to help students develop healthy lifestyle and nurture good moral character. In 2019-20 school year, be grateful and treasure what we have. Stay positive and positive. Optimistic has been adopted as the theme. And we organize various promotion activities. We also attach importance to the mental health of students and providing structured gatekeeping training for teachers to enhance their professional capabilities in catering for students with mental health needs. We also organize and provide online resources to help nurture good mental health among parents and students. In the new school new year, we prepared to start the day full of energy for every student and recommended a range of class-based, grade-based, or whole school activities in order to strengthen students' sense of connectedness with schools, teachers, and peers and create a caring and supportive atmosphere on campus. We will keep a close eye on the development of the epidemic. We will continue to liaise with the school sector, and we would seek professional advice from health experts with a view to reviewing the anti-epidemic measures and schooling arrangements in a timely manner. I'm happy to answer members' questions. Now, we have 11 members who would like to ask a question. The first one is Ms. Lillian Kwok. Well, let me read out the names first. Lillian Kwok, Edward Le, Rock Chan, Lam Chen Sing, Chaman Kong, Chan Ho Yan, Tang Fei, Chi Kwok Kang, Stanley Ng, Tik Chi-yuen, and myself. So that's the order. First one, Ms. Lillian Kwok. Thank you, Chairman. In the past few years, we are seeing the epidemic. I believe that the EDB, and the schools and the teachers have worked very hard to safeguard the health of students and their life. But in the society, we are seeing resumption of normalcy. But then the schools are still maintaining a lot of anti-epidemic policies. A lot of frontline teachers have told us, in relation to primary school and kindergartens, can we treat them separately? For those aged 3 to 11, they are lumped into a same group for the purpose of devising anti-epidemic measures. In the primary school, we are seeing a rising vaccination rate. So can we separate this group of students from others and draw up different anti-epidemic measures? And for kindergartens, well, there are some students or pupils in N classes, and their vaccination rate has always been worrying. So can we actually separate them and then treat them in a different way? Second, for very young children, well, as parents, you are very concerned about them. You are encouraging them to receive vaccines, and if they don't take vaccines, then they are not allowed to do certain things. But well, it's really difficult for us to take very young children to receive vaccination. So EDB, what is your take of the situation? Well, under what circumstances will they be able to allow to lead a normal life? What is your timetable? And then thirdly, about special schools. Right now, in some boarding sections of special schools, it is very possible that there will be an outbreak. And they are facing this problem. If there is an outbreak, of course, they do have medical staff in the schools, but then they are not specialists in fighting the epidemic, and they're not experts in really taking care of the confirmed cases. And then, if there is an outbreak, for those staying in the boarding school, they might have to be taken to the hospital. They might have to wait for some time. So how would you treat those close contacts and also the confirmed patients? So can the EDB and the Department of Health issue clearer guidelines for them? Because this group of students has even lower self-care capability than primary school and kindergarten pupils. And teachers and workers in these schools don't have clear guidelines, and they don't know where to turn to for help. They are only asked to wait. So this is not desirable. So can there be collaboration in that regard? So what will you do in face of that kind of situation? Secretary, let me first respond to the first and second questions. And the third question is about the arrangement in relation to outbreak in a special school. I will ask my colleague to elaborate. First, about the vaccination rate of primary and kindergarten students. Can these groups be separated in relation to how we treat them? Yes, we are already doing that. Currently, well, for the central authorities, it's those aged 2 to 11 are grouped into one group. We are trying to see if we can separate them into two groups, say 2 to 5 and 6 to 11. So this is what we are contemplating in relation to calculation of the vaccination rate. Now we try to resume normalcy as much as possible. This is the direction that we are aiming at. We are working very hard towards that goal. For primary schools, if a student has been fully vaccinated, i.e., he can fulfill the requirement of the vaccine pass, he can take part in some afternoon activities and some non-academic activities. And for secondary schools, some 300 schools are eligible to resume full-day classes. We are keeping close eyes on the situation. For primary school students, they have lower self-care capability, so we have to be extra careful in our anti-epidemic measures. We are discussing with the school sector and also the experts to make sure we strike a balance between encouraging learning and epidemic prevention. So we would take a orderly and progressive approach. And for students in N classes and those aged above 3, well, they are two different groups. For kindergartens, we don't have any activities in the afternoon. Well, but we still have after-school care services. So if children have been vaccinated, they can still stay in the schools. So we are working with the LWB in that. Thirdly, about outbreaks in special schools, what we will do. Thank you. For boarding section of the special schools, if there is an outbreak, in paragraph 4.2 of the health protection measures of schools, the procedures have been set out. Put simply, if there is an outbreak, the Center for Health Protection suggestion is that the students should stay first in the boarding sections, and then the CHP will come and make suggestions on triaging the students. They may have to stay in the school still, or they may have to be taken to another isolation facility. So the CHP will provide expert advice to the schools in doing all these. Now, we mentioned about a hotline. We have a general hotline, but we know that there might be emergency situations. So in the last incident, the CHP had been very good in that they have provided a special email platform for inquiry by the schools. So the schools can actually liaise with the CHP anytime, not just limited to office hours. Mr. Edward Leung, thank you. Madam Chair, thank you, Secretary. In November, if schools have to resume full-day classes, 90% of the students have to be fully vaccinated. But a lot of parents told us they're worried about taking their children to receive the vaccines. They're very concerned. And so by November, the 90% target may not be achieved, and the schools cannot resume full-day classes. So, Secretary, would you consider lowering the threshold, say, from 90% to 80%? And if some schools achieve a rate of, say, 80% to percent, they're allowed to resume full classes. And for some of the students who are not vaccinated, they can take a PCR test as an alternative. Now, if you are not going to consider lowering your threshold, would you be providing certain advice or service to these parents who have concern? Would you refer them to, say, to a clinic to get some advice or to get some health checkup and so on? Well, the adjustment on 1st November is actually in line with the policy in relation to the vaccine pass. So we're, in fact, allowing some time for students to get vaccinated. So if students have yet to get a 3rd dose and they still have time, so we are quite lenient in that regard. Now, for vaccination rate among secondary school students, for those who have received 2 doses or fulfilled the vaccine pass, I mentioned that some 300 schools can actually resume full-day classes. So what we're talking about is that we need students to take a 3rd dose. So if students receive the 3rd dose, then that will be fine. The impact will not be too great. We do have outreach vaccination service to schools. Now, if a majority of the students in the school need to take the 3rd dose, we can arrange for the outreach vaccination service for them. Now, some students have been very worried about the vaccination. We have been working together with pediatricians who have hosted talks to allay parents' worries, and they've told parents that if for non-vaccinated children, if they are confirmed, then they will be in great danger because the risk of severe cases and fatalities is very high. So we hope that parents can take their children to receive the vaccination as soon as possible. If you are not sure whether you are fit for taking the dose or not, well, doctors in the clinics can help parents check whether their children are suitable for vaccination or not. Some doctors are actually serving as volunteers to look at children in some boarding schools and so on and see whether they are fit for vaccines and vaccination. If yes, they will organize an outreach service for them. Mr. Rock Chan. Thank you, Madam Chair. The Secretary has briefed us on the great number of measures in support of learning by CBS students under the epidemic. I would like to follow up. Well, you have provided a number of support measures. That's very good. But have you made an assessment of the fact that if CBS students learn online on a long-time basis, what will be the impact on their personal development, both physically and psychologically? And if you find that there is negative impact, so can the EDB tell us how the measures you mentioned will help mitigate these difficulties, how you would make sure that they would really grow up happily and healthily?
Secretary, thank you, Mr. Chen, for your question. We do understand that for a long time, because of the cross-boundary restrictions, CBS cannot take part in face-to-face classes. On the one hand, the Bureau has provided learning support to these students, and on the other hand, we also take care of their social and psychological needs. We do understand that there are bound to be some impacts on CBS. So when it comes to psychological support, now most CBS live in Shenzhen, where situation permitted. We arranged for small group meetings to provide interpersonal interaction so that students could meet their schoolmates and also teachers and professionals. We have continued this arrangement this year. We also arrange for gathering a contact point for parents to get hold of the necessary resources. I understand that some schools have arranged for teachers to organize real-time online lessons. So as far as possible, we provide opportunities for CBS to meet with one another. But then CBS will have to come to Hong Kong and return to the mainland on a daily basis. They cannot use the come to Hong Kong and return to Hong Kong schemes. Mr. Leung Tsz-wing, thank you, Chair. The epidemic situation is now stable, and the anti-epidemic measures have relaxed, and we're gradually removing some of the travel restrictions. I hope the same can apply to students. I hope we can have a final plan subject to approval or subject to the fulfilling the vaccination requirement. We can resume whole day schooling as far as possible, so that for students that do not opt for extracurricular activities, they can stay behind in the afternoon for self-study, etc. Because the 2 years or so of epidemic have affected the parents as well. As for support to students, the paper mentioned subsidies for needy students to procure computers and to support online learning, but that may not be sufficient. Some parents do not have time to accompany their children in taking e-classes, and teachers may not be able to appraise the learning progress of the students. So for existing measures such as school-based after-school support and learning scheme, can you enhance resources for these schemes so that students can take part in after-school activities and learning, so that students' learning progress will not be affected because of the epidemic? On resumption of whole day face-to-face classes in primary schools and also vaccination requirement, because the vaccine pass threshold has been lowered to 5 years old. So we have to fulfill the vaccine pass requirement. Whether there can be whole day classes in primary school will depend on whether these schools can fulfill the vaccination requirement. Now, primary students are much younger and they are less able to take care of themselves. So in addition to vaccination consideration, we also consider the self-care abilities of students and also schools' ability to put in place safeguards. So to play safe, we will proceed with caution and adopt an progressive approach. We have discussed with primary schools. Now, if schools resume whole day classes by grades or by classes, that would create difficulties, because many of them have school bus services. So our target is to resume whole day classes for the whole school, and we will maintain liaison with schools as regards how we can support needy families or students with financial needs. Now we are providing hardware such as tablets, and we also provide internet access subsidies. Teachers are also using phones and face-to-face interviews with students to support their learning. Hopefully, when the epidemic is under control, more students can take part. For schools that cannot resume whole-day classes wholesale, students that have completed the vaccination requirements can take part in non-academic activities after school. Some can also stay behind for self-study, etc. Thank you. Dr. Chow-Meng Kwong. Good morning, Chair. Good morning, Secretary. We very much want to contain the epidemic, but whether schools can resume whole-day face-to-face classes will have an impact on parents as well. Many parents have said that they cannot work properly. They cannot go to work because schools are not operating on a whole-day basis, and then the family's finance is being affected. Yes, we have 3 targets. First, to reduce the number of severe cases, and second, to enhance ventilation. According to overseas literature, if we can enhance ventilation, we can reduce the risk of the disease. Now, because schools have air conditioning, but there are air purification devices, if we can have 1 or 2 of them placed in each classroom, that will go a long way. And if for a particular class, if we have 1 or 2 students tested positive, how do you sterilize the whole classroom? Usually, people are very, we used to be very concerned whenever there is 1 or 2 cases. People would don full PPE in order to disinfect the classrooms. Nowadays, schools may only ask a couple of staff members to clean the classroom with 1 to 99 parts of bleach. So can there be guidelines for schools, or can there be a dedicated scheme to disinfect schools so that parents will be more assured? Can you provide subsidy for them for buying of air purifiers and also teams for disinfection of school? And then SEN students need training most. If they cannot contact teachers and professionals and therapists for a long time, there will be profound impact on their development. Now, over 200 SEN students have been polled, and close to 60% of them said that they could not concentrate learning at home. So is there any support for schools to cater for the needs of SEN so that they can catch up more quickly for healthy development? And how our kindergartens and primary schools support SEN students? Now they are worried that if too much support is given to SEN, they may attract other SEN students to enroll in their schools. So can you enhance transparency and publicity? You should tell schools to make public their support for SEN students to benefit parents when they are trying to find the right schools for their students, for their children. Thank you. Thank you, Dr. Chow, for your questions. Suggestions for schools to fight the pandemic, for instance, enhancing ventilation. Now, in the second part of the last academic year, we have helped schools to improve ventilation rate in school halls or classrooms, etc. And for direct subsidy schools, we provided funding for schools to follow up in this regard. So we're really improving the ventilation of schools. We've already covered kindergartens. And as for cleaning and disinfection, we have given very clear guidelines to schools on how to use bleach and the alcohol percentage for disinfection and how regular should places be cleaned. We have given very clear guidelines to schools. And the most efficient way is for schools to clean their premises where necessary rather than to wait for the bureau or department to send somebody to help. Where deep cleansing and disinfection is needed, well, we will take note of their needs. And as for face-to-face classes and therapies needed by students with SEN, all these have resumed. Dr. Chow asked schools to be more transparent and make known their support for SEN students. We do support that. If there are measures to support SEN report, schools are required to provide a report on that. But schools are usually very humble. Usually they do more than is required. But then we do not want too many SEN students to go to one or two schools, and this is an integrated policy. We hope there can be more interaction and communication between students of SEN and their ordinary counterparts.
Ms. Rebecca Chen, now let me say this. There are some members on the queue. We do have sufficient time, and I'll allow the secretary to reply as much as possible. And I hope that your questions can be answered by the secretary. I know that a lot of parents are tuning into the discussion now, so I've been lenient as far as time is concerned. I think this is an important subject matter, and we do have sufficient time. Ms. Rebecca Chen. I know that the administration has done a lot to make it possible for schools to resume normal operation. Now, after the epidemic, schools are becoming normal after the Easter holidays. Now, every student is required to do an RAT before going to school, but the administration provides RAT kits only to those in economic or financial needs. I'm a parent myself. I have seen a lot of district councillors distributing RAT kits to students. Why don't you simplify your work? Well, give it to every student. For wherever you identify there is a problem with the sewage, you are distributing free RAT kits. And I hope that you can consider changing your policy. Distribute the free RAT kits to all students in Hong Kong and not just those in financial need. Second, when we talk about resumption of normal schooling, it's not just that about whole day schooling. There are a lot of follow-up issues that you need to tackle. I'm a parent myself. While the epidemic has been with us for close to 3 years, we have been counting on e-learning. And our students are very smart and clever. When you think they are actually learning through your online device, they are actually doing a lot of other things as well. So this is something that we should not ignore. So this is a follow-up issue that we should tackle. A lot of parents are fighting with their children over the use of computer, and it used to be the problem for secondary school students. Now, primary school students are also having the same problem. Now, the third point, would you collaborate with the Health Bureau to conduct a survey on students' eyesight, because they are watching or they're using the computer all the time. And because of the epidemic, the students' dental care service has been suspended for a year. So would the EDB take the initiative to conduct a study together with the Department of Health to see how we can help with possible dental problems of students? That can ease the pressure of parents. Now, then, for SEN students, the parents are in great emotional stress. So can you help these parents as well? Thank you, Secretary. Well, the first question raised by Ms. Chen is about distributing free RAT kits to all families in Hong Kong. We want to focus on those in need only. Well, actually, we are already distributing a large quantity of our free RAT kits, and a lot of public money is involved. When resources are not unlimited, we want to focus on helping those in real need. We have also reserved some kits for schools to use at discretion to distribute them to those who need it. And then after the epidemic, the students may have difficulties in various areas in relation to eyesight, dental issues, emotional issues, and so on. We are watching closely those aspects, and we are providing different resources and teaching resources progressively to help teachers help students. Now, as far as medical services concerned, and we are rerunning those services if the circumstances allow. And we also attach importance to parent education. We have established a smart parent net and uploaded short videos teaching parents how to control their emotions, how to interact with their children. We have asked experts to host seminars and so on. And we would like to work with the relevant organizations to host seminars for parents. It would be best if we have a whole day schooling so that students do not have to stay in the home with parents for a long time, and we are striving to do that. So in order for us to do that, we urge children to get vaccinated as soon as possible, because that will help reduce the risk of severe cases and fatalities, and we can also erect a protective barrier, and then people can can study and learn in a safe environment. So if we can do that, then other things can follow. Let me supplement. So I hope that you can distribute free RA tickets to every family in Hong Kong. so that families do not have to shoulder a heavy financial burden. Mr. Tang Fei. Good morning, Secretary. I have 3 simple questions. First, the government is relaxing a number of social distancing measures, restrictions on traveling and so on. So parents are expecting that whole day schooling will be provided soon. But then that seems to conflict with the present policy. For secondary schools, you are asking students to take 3 doses. It will be very difficult to ask primary school students to receive 3 doses as well. So how you actually reconciliate these 2 areas, because there seems to be a conflict. Well, we cannot have half-day classes indefinitely. Second point, news reports tell us that we will be seeing a peak in the seasonal flu very soon. But then a lot of people, fewer people are taking flu vaccines. Well, the peak of seasonal flu is coming soon. How can we make sure that the primary and secondary students will also receive the flu vaccine when they have not yet received the COVID-19 vaccines? Now, in the schools, when students have been infected, it seems that the schools can decide whether the relevant classes should be suspended, because I have seen different schools making different decisions based on different criteria. This is inconceivable. So I don't think that this should not be a school-based decision. The administration should have a coordinated arrangement. So in cases where certain students in a class are infected, how would that class be treated or handled? Secretary, thank you, Mr. Tang, for your question. First, about a resumption of whole-day face-to-face classes in primary schools. Will there be a relaxation? Like I said, we will strive to have to resume normal school life. But then the pandemic fluctuates all the time. Will there be a new mutant strain and so on? We have to keep a close eye on that, because the number fluctuates, from time to time, from 3,000 to 4,000. Now, primary school students are very young, and if we arbitrarily resume whole-day classes, then the risks may be high. So like I said, let's work together. Well, at least we should get more students vaccinated so that we can erect a protective barrier. And then we will be in a position to do something more. We can't control the pandemic. If the vaccination rate among students is high, and then the schools can make sure that there is a safe learning environment, and then we will be in a position to resume whole-day schooling. Well, the decision to suspend classes is not made by the schools themselves. Well, which classes will be suspended? Well, the advice has to be sought from the Department of Health. It's not the schools which decides on this. Next, Mr. Chu Kwok-kang. Thank you, Madam Chair. Well, CBS face a lot of difficulties. We all know about that. The EDB is providing support services on the mainland, but then only a few percentage points of students are participating. Several months ago, I conducted a questionnaire survey among parents of CBS CBS, and within 1 week, I have received responses from 6,000 parents. Only 5% of them have received services from UDB, and most of them think that the result is not satisfactory. Will the government consider committing more funding and expand the scope of the services to benefit more students? And also, the quality has to be boosted as well. And for cross-boundary SEN students, there is inadequate support because, only face-to-face support services will be effective. So can the government consider doing something more? Will the government consider providing more resources? Say, if a school is willing to send teachers to the mainland to teach the students face-to-face, will you consider providing subsidy to such schools to operate such a teaching center? For my school, we're already doing that, and the academic results of the students concerned have been greatly enhanced. So, if there is such an incentive, the schools are willing to send teachers to the mainland to provide such a service. And a lot of schools told me that their anti-epidemic funds have been exhausted long time ago. Well, primary and secondary schools are better off, but for kindergartens, they have a more difficult situation, and they have to use their own reserve to bring in supply teachers in place of teachers who have confirmed. Now, recurrent funding is provided to secondary schools, and the assumption is that every teacher will take 1.5 sick day leave every year. Well, we have been saying that kindergartens are a lack of funding, and during the pandemic, a lot of teachers have to take leave because they're infected. So how can they get the funding to bring in supply teachers? And in fact, a lot of principals are actually teaching as teachers themselves. And as a result, kindergartens are running out of funding, schools may have to close down, and teachers may go out of job. And the implications are far-reaching. So we don't want to see that happening. Even though government resources are limited, we are still doing our best job. We will do the best anti-epidemic work. So we are feeling helpless because of the government's unwillingness to help us. So I hope that the government can set up a special fund to help kindergartens during the epidemic. As long as the epidemic is with us, I hope that the funding can be provided to kindergartens to help them bring in supply teachers. And maybe additional criteria can be put in by the government in dispersing the funding. These can be provided to the kindergartens who are still running a service in spite of the difficulties. So that would be good. So I hope that funding dispersed on a cost reimbursement basis can be provided to the kindergartens to help them bring in supply teachers.
Secretary, thank you. On support to CBS, whether we can expand our scope of support. In fact, we've always wanted to benefit more students. In between May and August 2021, there were 6,000 or so students. Of course, that is just a small portion of the over 10,000 CBS we have. It's not that we don't want to serve more CBS. Rather, we are constrained by the number of quality service providers. Of course, when it comes to the mode of operation, when normal cross-boundary travel is resumed, then the investment of these service providers may come to a waste. But of course, we will keep review the situation and support for students of special education needs and also CBS. Schools can make use of various grants, and if they have difficulties, they can reflect to us their actual situation. And for KGs, now we have disbursed more than one round of special subsidy for fighting the epidemic to KGs. Money aside, we've also distributed anti-epidemic resources such as masks to KGs. And of course, because of the epidemic, there may be a greater need to employ substitute teachers, because when we worked out the manpower ratio of KGs we've taken into account the need for substitution teachers. The ratio is 1:11 because kids do attach to adults in particular, so it may not be very desirable to find someone else out of school to be substitute teachers or to be supply teachers. But then I have heard your views. We will consider the situation of KGs, and it's not that we are totally careless of the needs of the education sector. All right, Mr. Stanley, I want to thank the Bureau for their efforts in helping schools to cope with the epidemic. Now, I have a question on full day face-to-face classes. You have a target, but then resumption of half-day face-to-face classes have resumed for 1 month. I'd like to know how you can ensure that you can progress as planned, because face-to-face classes is very important to students. So we must give everyone, parents in particular, the full picture. Another question is on vaccination. The Bureau is collecting vaccination rates. I'd like to know how you are going to use such statistics. Are there schools that require your assistance in understanding the importance of vaccination? Will there be healthcare staff to help them to understand the importance? And the third question is in relation to the psychological health of students. Indeed, they've been affected because of the epidemic. But then it's because the epidemic has worsened their psychological issues. There are many students with psychological issues in schools, but then not all schools know how to cope with such cases. When parents or students encounter these problems, they are rather helpless. I hope the Bureau can enhance counseling services so that students can be more resilient to adversities and brought about by the epidemic. And the fourth question is about support for cross-boundary students, CBS. I understand that many CBS have enrolled in schools on the mainland, and so it's a fact that you are losing students to the mainland. So will you just let them be? Will you expect them to come back after the epidemic? If what about the impact on our school sector as a result of the loss of CBS secretary? Thank you. Starting from the 1st of November, we are going to resume face-to-face half-day teaching for primary schools. We closely monitor the situation, and we will allow time for students to be fully vaccinated. Because of the vaccine pass, we have updated our vaccination requirement for face-to-face classes. Now, students and also teachers need to eat out, and they have to fulfill the requirements of vaccine pass anyway. So we're asking schools to urge students that require one more dose of vaccine to get vaccinated as soon as possible. We compile vaccination statistics on a monthly basis. That is useful for our assessing the conditions required for full normalcy, and then it will help us to be more targeted in our promotion of vaccination. As for mental health, we do note that problem in terms of teacher training, and even for parents and students, we have gatekeeping training for teachers. We have online platforms, and we are also enhancing the collaboration scheme between the hospital authority, the SWD, and the Education Bureau. So for confirmed mental cases of the hospital authority, now our approach is for early identification and support as necessary. So for students who need it, we provide support, and for teachers, we also arrange different seminars for schools to help them to relieve their pressure. As for CBS, yes, the reality is they cannot come back for classes. So we allow them to enroll for a new academic year online. We give them the opportunity to enroll online. So if we still include them in our overall statistics if they were able to enroll online. Schools very much want to keep CBS, but if since they cannot come to Hong Kong for classes, and if parents have got the most suitable environment for the development of these children, we do support such efforts. To attract them to come back, well, after cross-boundary travel has resumed, we will think of various ways and means. Relationship between schools and parents are important. We understand that many schools are providing much needed support and services to parents and students. And if there is anything, we can support schools to comply with our policy. We're willing to help. Dr. Tick, we understand that we should resume face-to-face classes as far as possible. It's needed by students and much hoped for by parents. But it appears that we are still marking time. I don't see any clear timetable and roadmap so that our schools or our parents, our students can return to face-to-face classes happily. We have vaccination requirements, and I appreciate that the government has done a lot of publicity and public education. Now the problem is parents are not willing to get their children vaccinated. It's not that they don't have the time. Now I've heard parents saying this. It used to take a long time for a vaccine to be developed and used. And as for vaccines COVID vaccines, they are just given temporary approval. Experts are saying that it is safe to use them, but parents are concerned whether there will be side effects. 5 years, 10 years down the road, we cannot overlook the concerns of parents. So it's difficult to convince parents. It's not that they don't want their children to attend face-to-face classes. They do love their children. My concern is it would be a long time before face-to-face classes can resume fully. And I'd like to know the direction of anti-epidemic measures. As we all know, we are relaxing our social distancing measures. Yesterday, people could start to eat together in a table of 12. We have seen elderly persons eating together with their masks off. In fact, the society is resuming its normal activities. So, Secretary, can you make a breakthrough? If vaccination rates are still low or not satisfactory, is there any way you can allow our children to resume face-to-face classes? And many students face difficulties, in particular SEN students and also students in special schools. Can the Bureau encourage schools to assess all students and set up individual education plans for them? So for students that have fallen behind during the epidemic, you have to give them special help. We should provide individual educational plans for SEN students and students in special schools. And the mental health of many families is in trouble. I hope we can have more school social workers and support for these families. Thank you, Secretary. Whether we will have any innovative approach. Well, as I said, vaccination rate is but one of the considerations. Still, it is an important one, given that our students are still young and they stay a long time in school and there is a lot of interaction. After vaccination, we can greatly reduce the percentage of severe cases and even fatalities. Now, without any protection from vaccines, when children gather together, once there is a transmission, then the problem can be a major one. Now, we cherish our children. We don't want to have an outbreak resulting in very high risks. So no matter how difficult it is, we are begging and urging our school children to get vaccinated because that is the most basic safeguard they can get. Given that they have to stay in schools for the whole day with vaccination, then they can play and learn together freely with their masks off because if there are too many restrictions, then this is detrimental to the development of school children. And you have to bear in mind that there are parents and maybe grannies are living with these children. So the risks are high, and we don't want to see undesirable consequences. So we are studying whether we can any safe and innovative measure to allow our children to attend school happily.
So we are keeping close tabs on that. For very young children, what we can do now is to ask them to do RAT every day to reduce the risk of transmission in school. And the second way is to get vaccination. For SEN students, I believe that schools will monitor their situation based on the interactions between teachers and students. And then for mental health of family members, we should do a lot more work. I know that under the pandemic, the family has a lot of pressure to withstand. So through the PTAs and other ways like posters, online video clips, cheer up cards, and so on. Through all ways and means, we'd like to enhance the mental well-being of the parents. Now it's my turn to ask a question. First, Secretary, can you give us some information on number one? If we are to freely distribute RAT kits to every student, how much will it cost? I support the proposal. I myself am giving away some free RAT kits. For some families, this is a heavy financial burden. I don't believe the NGOs can cover every family in need. I think the kits should be distributed by the government. I am in support of that proposal. Second is about your collaboration with the Shenzhen authorities on providing psychosocial support. What are the specifics? And then you are also mentioning about the life-wide learning grant in the document. How does it work actually? How much can it help the students? And then there is also the program on gatekeeping training and also open up. So what has been the feedback of these programs? Well, I am very detail-minded here. Why? Now, I have made some observations here. Well, the overall mentality of people has become defective, so to speak. I interact a lot with university students, and I've been helping a couple of them. They are very outstanding in their academic achievements, and they don't have any problem in online learning, but they have developed social anxiety. They are already on medication. I'm extremely concerned. Well, these are, very bright students, and ultimately they have really killed themselves. Now, I have been in contact with a lot of such students. You have to talk to them one-on-one in order to get to the bottom of their heart. I think the same problem happens among primary and secondary school students. For parents who refuse to have their children vaccinated, they very often over-worried. They have a lot of anxieties, I presume. And how they talk to the students will affect the way the students learn online. And some members talk about the after effects like, injury to the eyesight and so on and so forth. So how do the parents receive your policy? Matters a lot. Well, they refuse to get vaccinated, shows that they have great anxieties within themselves, and that can lead to serious consequences. Well, I have referred some jobs to some students. Well, they are supposed to be very bright students, but they didn't know how to answer questions. I think it has to do with their social anxiety, and I think the problem might be a lot more serious among young children. I think the government faces two options. In April, in the education panel meeting, I said the same. I think we should be very stringent in implementing anti-epidemic measures. we should avoid fatalities as much as possible. But now it's 6 months on, and we have seen a higher vaccination rate, and well, some 10,000 people have already passed away. And now I think it's the time for the society to focus on the positive side. We should muster the courage to step forward. First, we should work on the parents. If you choose not to have your children vaccinated, then you should, well, bear the consequence. I don't think our society can go on the way it is now. I'm extremely worried about how things are developing. Some students do not know how to take care of themselves. Of course, you have to support schools who teach mentally handicapped children. So would you consider committing more resources in helping the students? We still have some restrictions in place. I'm sure that there are problems in the family, and there is a lot of follow-up work to do. And the social workers can't handle all these difficulties. The social workers have burned out themselves. So how can they lend a hand to others? In the past 2 years, a lot of people have got worried, and they are not willing to tell you. They will tell you only when they talk to you face to face. So, well, there are some parents who refuse to have their children get vaccinated. There are some other types of parents and teachers and so on who need your extra support. So do you have any long-term plan? I'm giving you a list of issues to be tackled. Well, the 10A student that I have trained up, well, surprisingly or regrettably, the student doesn't know how to interact with others. You might need to spend another 3 years to help resolve all these problems. You don't have any extra manpower, so the existing staff members will only get burnt out. And I talk to them one-on-one to help them. So I think you should come up with good plans to resolve all the issues I raised. Thank you, Madam Chair. You refer to free distribution of free RA tickets to all people. Now we have some 800,000 students in Hong Kong, so you can make the sums, do the sums. Now for every month we are giving out 100 million kits and we didn't actually have the budget to pay for this. We actually are paying this out of our extra, some extra sources. So we should think about whether we should use the resources on this free distribution or use it on some other services. So can you be more specific? What is the total sum? You can actually do the sums yourself. Say it's $5 or $10 each. So times 800,000 students, times 7 days a week, 4 weeks a month, and so on. We're now spending $100 million to distribute free RA tickets to the students in need. So that is quite a burden to us. So we have to make up our minds as to where we should put our resources. If we are to spend the money on RA tickets, we might have to save up on other services. And just now we mentioned about boosting the support to help with the mental well-being of parents and students and so on. We do have limited resources. We should have more thoughts on that. And then about psychosocial support programs in Shenzhen. On the mainland, we require the relevant personnel to have professional qualifications. And the NGOs have to form a team, and there are uncertainties to the programs. And if the NGOs have to devote resources to build a center, then that means, well, extra commitment on the part of the NGOs. And we thank all parties to be helping us with all these. And you refer to the life-wide learning grant and so on. And the schools can deploy such grants to help the students in need. And then for the gatekeeping program open up, maybe I can ask our colleague to elaborate on that. I know that under the epidemic, people have problems with regard to their mental well-being. And it is important that those with problems have people around them to help them. We may not be able to see a doctor or professional very soon. So if everybody can chip in to help out, then we will be able to help more in the society. And for the gatekeeping training, we are providing the training to the peers, the teachers, and the parents, and so on. And the relevant information and the videos have been uploaded onto the website so that those who are keen to help others can also watch these or access these resources. The chair mentioned about the professional services hitting capacity already, and it is difficult for us to add in a lot of extra professional manpower to our services. We're facing a bottleneck in our services now, so we should join hands to do the best work. So can I ask my colleague to elaborate on the other tasks that we have? Now, talking about parents should watch out for their own mental wealth and their children's mental wealth. And in 2021, starting 21, we organize the gatekeeping training programs once every 3 to 4 months. And clinical psychologists are asked to conduct the training. We'll hope to enhance parents' awareness of mental health, and they should support their children. Now, for every batch, the number of places is 1,000 or so. So all along, the program has been welcomed by parents who found it very helpful. And there is also a dedicated web page in the EDB's website. We have a lot of tips and also other training programs. And there is also the a special curriculum framework for kindergartens. And we are now working on the kids for primary and secondary schools. And we will help parents to learn about the pressure they are facing and how to alleviate them. And once the resource kits has been rolled out, we would work together with the schools to help parents, and we want to provide help to the parents. And this is something we attach a lot of importance to.
Now, we want the Bureau to give us this figure. Now, let's say for a period of 3 months or for a period of 6 months, how much resources is required. And if you need extra resources, then as legislators, we can, with this figure in mind, put it to the administration. Of course, you have to convince us if you want to secure extra resources. But then we will consider how best to resolve the problem. You may say that you won't be able to train enough professionals in 2 years. No, you can't say that because you don't have enough manpower now, you don't have medium-term plan. We maybe talk about 3 years, and if we can have sufficient professionals in 3 years' time, we may be able to help a lot of students. They will be able to integrate into society normally. So can you please give us these figures? Now, for instance, if we want to hand out free RA tickets to universally, how much resources is required? And also the amount you are spending on distributing RA kits to needy families only, because we have come across families who find RAT kits a heavy financial burden, and of course we should keep handing RAT kits out. All right, second round, I will allow Ms. Lillian Kwok. Thank you, Madam Chair. For RAT kits, I hope we can resume normal lives as soon as possible. In primary schools, for instance, can we resume whole day face-to-face classes? That is particularly so for senior primary classes. Now, for care homes, as we all know, the situation in care homes is dire. Now, together with Mr. Chen Han-pan, we provided mobile anti-epidemic devices to hostels for the mentally or physically handicapped students. Now, you may say that care homes are not the best place for quarantine or isolation because they don't have single rooms, but when it comes to other infectious diseases such as monkeypox, recently a new epidemic to Hong Kong. Now, I hope we can have sufficient isolation and quarantine facilities in hostels for students. And in Singapore, 80% of the educational institutions are receiving subsidies from government for spraying disinfectants on a regular basis in schools. There may be more infectious diseases in future. Can you subsidize schools for spraying antibacterial or viral coating in school environment? I understand that they have to spend over $200,000 per exercise. Dr. Choi, I understand the schools legislators would want whole day face-to-face classes to resume as soon as possible because parents have to work as well. So I'd like to urge children to get vaccinated the soonest possible so that we will be in a better position to resume whole day face-to-face classes. As for subsidizing schools to apply antibacterial coating, etc., as I said, there are grants available for schools to use, and if they are really in need of money, they cannot just no. And as for quarantine and isolation facilities at hostels for children? Can my colleague supplement? Thank you. Dr. Lau, can you speak closer to the microphone, please? We have been in liaison with the Department of Health, Center for Health Protection, the needs of special schools because the epidemic may spread faster in these environments. And I think suggestions are very good. We can use mobile devices, or perhaps we can have part of some isolation facilities to allow school children living in hostels to move in with facilities for isolation. We will consider different approaches so that when there is an outbreak of any kind of infectious disease, we can have isolation facilities available for our school children. With regard to the social and psychological support for students in Shenzhen, you told us that it was on a 4-month basis. Now for the learning support and psychological support programs in Shenzhen, I'd like to know how frequently do you run these programs, or are people trained to work as gatekeepers again? Now, there are 2 programs, one learning support program and the other psychological support program. The professionals or tutors will have to fulfill the qualification requirements in Hong Kong. They may have to be registered social worker or registered teachers. So there may be 1 or 2 classes per week, depending on the actual circumstances. We understand that Shenzhen is fighting the epidemic hard as well, because these services are not available in all small areas. So a contact point may serve several areas. So because of the anti-epidemic measures in Shenzhen, some of the programs cannot be conducted as planned. So if the restrictions in Shenzhen are relaxed, we will resume small group learning. They are not in the form of seminars or workshops. So they can meet face to face, right? So we are talking about professionals qualified in Hong Kong to provide psychological support to CBS. Well, some schools may have qualified Hong Kong teachers there. Will you allow video to assist your operation? Yes, I understand that there are restrictions, and right now the 2 programs are being suspended. But then these students are taking our own curriculum. They will have to sit the DSE examination in the future. So will we have any video support in case the face-to-face meetings are suspended because of anti-epidemic measures there? Well, teachers in Hong Kong have always been providing video sessions, because if they can see each other, it will be easier for teachers to offer help and support. So if counseling is needed, then teachers are providing that already to students. As regards services available in Shenzhen, we want to provide a face-to-face situation for students to meet, to have social interaction and learn together. So if we use a video, then that may not be the best approach. Well, in Hong Kong, there are already teachers taking care of CBS. Some of them are learning in real time with their classmates in Hong Kong. Please give us further information in the future so that we can know the progress. All right, so much for this item. We move on to the next. Homeschool cooperation and parent education. Members, please press the request to speak button if you wish to speak 4 minutes each. I will first invite Mr. Jeff Z, Undersecretary for Education, to join us. I also want to thank Dr. Choi-yuen for joining us in the last part of the meeting. Thank you. Mr. Jeff Z, Undersecretary for Education. Thank you. Good afternoon, members and members of the panel. Parents are the first teachers of students, and home setting is the first classroom of teachers. Parents play an important role in children's education, as mentioned by Dr. Choi in the last part of the meeting. So the Bureau has always supported homeschool cooperation and forge homeschool partnership and promote parent education. In December 2017, the Education Bureau made a number of recommendations, and they have been fully accepted by the task force, and the recommendations are being gradually implemented. On promoting homeschool cooperation, the Committee on Homeschool Cooperation, CHSC, has been encouraging schools to set up parent-teacher association. All government and aided schools, as well as over 1/3 of KGs, have set up PTAs. To encourage more KGs to set up PTAs, starting from the 2019-20 school year, the Bureau has enhanced the subsidy amount of the setup grants and annual grants for PTAs of KGs. And we're also helping KGs to further understand the procedures and matters pertaining to the establishment of PTAs. PTAs offer CHSC organizes regular sharing sessions on different topics to provide information and assistance to KG on the formation of PTAs. To encourage more schools to set up PTAs, we have already improved the application procedures for subsidy for PTAs. Starting from this year, application for the subsidy for PTA can be applied throughout the year. And newly established PTAs can submit their application for subsidy for homeschool cooperation activities throughout the year. And CHSC organizes various activities on homeschool cooperation, including workshops and seminars, competitions, symposiums, etc. And together with federations of PTAs, CHSC organizes a lot of talks for parents to equip them for better education of their children. And we've also started the Positive Parent campaign to help parents to build up a positive mentality to help their children to grow. We have organized various activities with excellent response from parents and schools. We'll continue to use APIs published on television and radio to reach out to parents in different districts. In order to promote the Positive Parent campaign, we'll continue to review and improve our measures to further parent education.
We hope that schools and parents could work hand in hand in cultivating students' positive attitudes to facilitate their healthy development and effective learning. So much for my briefing. I welcome questions by the chair and members. 5 members would like to ask a question. Each will be given 4 minutes. Ms. Lillian Kwok is the 6th one, Mr. Kenneth Leung, Dr. TIK Chi-yuen, Mr. Leung Tsz-wing, Mr. Stanley Ng, myself, and Ms. Lillian Kwok, a total of 6 members. First, Mr. Kenneth Leung, rather. I know that the administration is providing a lot of funding and teaching resources to support schools in organizing various parent education activities. These are listed in the paper, but we don't see the specific content of the various activities and also the quality of such programs. And how do you align these programs with the task force recommendations? Have you collected views of the parents to assess the effectiveness of such activities? Second, the paper says that these activities are organized based on the task force recommendations. That was made in April 2019, before the national security law was enacted and before the epidemic onset. In the past couple of years, there has been a sea change in our circumstances. So in your initiatives on parent or school cooperation, how would you incorporate an element in relation to the national security law? So we've always been saying that students or children should be taught in the family. The government is drafting the blueprint on youth development, and parents' participation is very important. The task force recommends that we should map out the future direction in the long term for parent education. So do you have a long-term plan to share with us? Thank you, Chair. Mr. C. Thank you, Madam Chair. Thank you, member, for your 3 questions. First, about examples of activities. Let me cite this example. Now, we have this positive parent campaign. A number of activities have been organized, including slogan competition, mascot design competition, and auspicious scrolls design competition. And we also have a naming competition for our mascot. And we also said that there are different kinds of seminars which will focus on issues of concern to parents. We have a Happy Child Charter, and we have invited doctors and representatives of the FPTA to have some sharing with us. And we have been gauging the effectiveness of our programs. Every time the program has been completed, we will assess the result and effectiveness. And different PTAs and FPTAs, after they have obtained funding from the government, they have to submit a report with an assessment of the program's effectiveness. Member also pointed out that the task force submitted its report before the epidemic. We would continue to review the recommendations. Now, after the national security law was enacted, we are facing a new situation, and we have the epidemic with us, and members have told us their views on how we should enhance the mental well-being of parents during the epidemic, and how we can design targeted activities to help students. Some PTAs and also the FPTAs on the handover date and also the National Day, we're organizing major activities in relation to the national security law, and a number of parents have participated. And for the blueprint on youth development, we understand that the Home Affairs and Youth Affairs Bureau are working hard on it, and it will be released towards the end of the year. And the EBD will cooperate in carrying out the recommendations in the blueprint. Dr. Tik Chi-yuen, I support the proposals raised in the paper on parent education. We should commend the EDB's efforts in promoting parent education. Later on, there will be a young child care center in Saiwan, and I believe there will be a lot more parent education work to be carried out there. These are good developments. Undersecretary, well, the recommendations or the proposals come from this report here. Can you submit the report to the legislators for our reference, so that we can read in the report? There are a number of strategies, activities proposed in the report, and it will take time to implement all the recommendations. Undersecretary, I have worked on parent education for some 30 years. I face a grave challenge. And because, well, education is a very competitive area, we told parents that children should learn in a happy way, but then children have too much homework to do, and they also have to sit for a lot of tests and exams. So it's difficult for parents to stay calm. Well, we say that we should learn through play, allow children to learn through play in kindergartens, but kindergarten pupils are taught to read and write because they would like to enroll in primary school. And there are already tutorial classes for kindergarten students. How can you talk about happy learning? Well, it's a joke that we should not just strive for good marks. Now, all children or parents are striving for good marks these days. So given the current education ambient, children cannot learn happily. So we support doing more parent education work, of course. But let's focus on happy learning here. Well, at least we should do this in kindergartens. We used to do quite a good job in kindergartens, but not now. So EDB, please pay special attention to this. Provide a happy learning environment for kindergarten students. If that is the case, then there will be better parent-child relationship. Parents will be in a better position to provide happy learning for their children. So if that can be done in the kindergartens, then, well, we would it would make it easier for us to do the same in primary and secondary school. So please provide a happy learning environment for our young children. Mr. C, well, I believe you noted that. Thank you, Chair. And I'd like to thank Dr. Tik for his long-term support for parent education. And you have once served as the chairman of the Committee on Homeschool Cooperation. You have made great contributions, provided valuable views. And in June this year, the education panel supported us in building a young child care center in Saiwan. We thank you for that. And for this child care center, our aim is to provide parent education to parents there. This will be an extra venue for us to do parent education work. You talk about education being a very competitive arena. Now, in the task force under the CHSC, we aim to tell parents to avoid over-competition through publicity and public education work. The aim of the Positive Parent campaign is exactly that. We have this program in which we have hosted a number of exhibitions across the territory. We have organized table games to bring out positive messages. Towards the end of the year, in our API, we would adopt the same theme. That will be rolled out soon. So we would like to change the parents' mindset step by step. In Annex 1 of the paper, we have outlined the key recommendations of the task force, long-term, mid-term, and short-term measures are being set out. If members would like to have the full report, we're more than happy to provide the same. Let me say this. I would like to use my discretion to extend the meeting time for 15 minutes. And then members, would you please be succinct in your questions? So I would allow each member 4 minutes, and please leave some time for the Undersecretary to respond. Mr. Lam Chun Sing. I know that EDB has been encouraging schools to set up PTAs, but only 1/3 of KGs have set up PTAs. And I know that the EDB has certain measures to encourage more kindergartens to set up PTAs. The situation can be likened to the 3-knee buildings in the old districts, and the owners are not willing to set up an owners incorporation, and the HAD staff are trying to liaise it with them, and subsidies is dispersed to encourage them to set up the owners incorporations. I think the situation here in kindergartens in setting up PTAs is similar. Would you set a target? There might be different factors affecting whether you can achieve the target, like resources, cooperation from the kindergartens and parents and so on. But at least we should draw up a target. Say in 1 year's time or 3 years' time, certain achievements can be made. So hopefully more KGs can set up PDAs. And then can you not conduct more researches and surveys? For some KGs, they are not willing to set up PTAs because of certain difficulties. Is it because the teachers already have an onerous workload? Or for some KGs, the parents are working in certain professions and they don't have the time to take part in PTA's work, or the parents have different views on PTAs as something that the PTAs are useless and so on. So I hope that you can conduct more surveys so that we can draw up the right measures to encourage KGs to set up PTAs. And hopefully a target can also be set. Mr. C. Thank you, Chair. Thank you, Mr. Lam, for your questions. Indeed, the percentage of KGs setting up PDAs, well, there is still room for improvement, although the percentage now is 1/3. Now, after all, a child stays in the KG for only 3 years, while that for primary school is 6 years. Now, very seldom that in the first year, the parents will take part in the work of the PTA. When the parent gets more involved, his or her child is close to graduation. That might be one factor. And that might not be related to the teacher's workload or the professions that parents are in.
Because KG teachers have very close contact of parents. I've just got a kid who graduated from KG, and I used to receive updates from the teacher to myself and my wife, telling us the situation of our child in KG. Aside from last year, the Bureau has been providing a one-off 90 to 100,000 subsidy to encourage schools to kickstart the organization of structured parent education programs, and that includes the setting up of PTAs or to enhance a designated web page resources for parents on their school websites. This will promote communication between KGs and parents. We've received about application from about 70 KGs. That is additional number of KGs who have undertaken that by the 31st of August 2024, they will have a PTA set up in their school. That is quite a good percentage, but we will continue to work on it. Mr. Stanley Ng, I've also got 2 questions to follow up. First, double income families' participation in PTAs. In Hong Kong, the working hours are very long. For double income families, parents have too little time to take care of their children. What targeted measures does the Bureau have to encourage our double income families to participate more in PTAs and in communication with schools? The second question is, because of the epidemic, we have seen more tension between parents and children. We've heard reports that they might have quarrels and even fights. What is the Bureau doing to help parents to get along better with their children so as to diffuse the tension? Thank you. The first question is about support for double income families. I understand that there are more employers and corporations adopting family-friendly policies. There are more companies in the private sector which understand the importance of parents' education. Some corporations have their own parents' education activities and workshops. Our plan is to use the parent website, smart parent website, so that we can have electronic information, so that when parents are traveling to work, they can use their mobile phones to browse the Smart Parent Net website. This is a way to disseminate information to parents. The Bureau will cooperate with post-secondary institutions and NGOs in developing online learning materials and resources. And the second question relates to rows in the family during the epidemic. With or without an epidemic, communication between parents and children requires skills and is also an important aspect. As mentioned by the Secretary in the last agenda item, during the epidemic, there have been gatekeepers training for teachers, and online thematic talks include how to enhance children's resilience to adversities, how to be more adaptable, etc. Hopefully, through such training, we can better equip parents to communicate with their children, and experts also offer advice on how to deal with parent-child relationship. Hopefully, we can have more thematic talks targeted at the current epidemic situation. Hopefully, our experts can give us more tips and suggestions for our parents. Thank you. All right, it's now my time. I fully subscribe to the idea of happy learning starting from KGs, but because of the epidemic and also drop in student population, KG operators and management face difficulties in poor enrollment, and they are focusing their efforts on admission. Only 1/3 of the KGs have got PTAs. In 2019, we had a report from the task force giving us statistics reflecting the current situation. KG operators, must they spend that one-off subsidy of $90,000 to $100,000 to set up PTAs? Do they have the flexibility of spending the money elsewhere? Now, if they are not operating successfully, then they may not have the energy to set up PTAs. We face a domino effect with a fall in student population. KGs have to tackle the challenge of insufficient student enrollment. What measures do you have to help KGs? If a KG winds up, then teachers and parents will surely be affected. Coupled with the epidemic, when this is even more challenging, and KGs may not be able to approach each and every parent directly. I think both agenda items are the same. We need to think of measures to help. Now, for your website and online resources, we have no problem with that. They may help to address the imminent problems, but the crux of the matter lies with medium and long-term planning. We have given you the first order today. You have to face up to this problem. If we have a KG, of course, we want a PTA to operate. Otherwise, parents will be anxious. As explained, it is unlikely that 3 years after the epidemic, the children would be perfectly normal as if they had not gone through 3 years of epidemic. All the problems and impacts will surface in 3 years' time. So with a subsidy, will it make it more likely for PTAs to be set up in KGs? How effective is it? Thank you. I cannot agree more, Chair. It is important for students, for KG students, to have happy learning. And when we formulate the guidelines for kindergartens, we attach significance to this part. You mentioned challenges in student enrollment. We fully understand that because of the structural decline in student population, KGs are the first to bear the brunt because the admission age is 3 years old. And we also note the lower birth rate in Hong Kong. We will continue to discuss with the KG sector to see what support measures can be provided to support KGs. Chairman, you asked whether the one-off subsidy of around $100,000 be used elsewhere. The answer is no, because it is a dedicated fund. It has to be spent on parents' education or establishment of PTAs or school parent cooperation activities. While we are faced with a decline in population, if KGs are anxious about student enrollment, that is the best opportunity for KGs to improve parent-school communication. Now, if the student enrollment is not desirable, parents may consider taking their children to another school next year. I think it's not possible, but then I hope KGs can improve communication with parents. Well, if you don't object, Secretary, I'd like to extend the meeting for another 15 minutes. Now, universities are on the receiving end. I don't encourage monsters parents in Hong Kong. I have seen university students taking gap year. And you said that when the competition is keen, then this is an incentive for KGs to set up PTAs. I'm afraid that doesn't answer my question. Of course, KGs have to compete amongst themselves, but my question is, with fall in student population, PTA is not the solution. You must have a plan. You really have to have a thorough plan. And after one KG, I set up a PTA, and if it publicizes about it, then it may impact on another KG. So we said that early next year we have to discuss the impact on our education sector or even system because of a fall in student population. I think all these matters are interrelated. Ms. Lillian Kwok. Thank you, Madam Chair. As we all know, school parent cooperation and parent education are most important, and this is indispensable to the healthy development of a child. I'd like to know support to families. I think the LWB as well as the EDB should work on this together. And as for parents' education, you have provided a lot of guidelines. Now, for education, we must objectives and curriculum, syllabus, and also a system. Where are these for parents' education? Parent education is so important to children, and it should start at year 0. But parent education now only starts at KG level. By the time a kid goes to KG, there may already be struggles between the parent and the child. I understand that different bureaus, such as the Home Affairs and Youth Bureau and even the Health Bureau, may be involved.
Should we get a comprehensive look at all these and come up with an integrated approach to make sure that there is comprehensive support to parents and that there are children grow up happily? Thank you, Ms. Kwok, for your question. Well, some people are even saying that we should start even before year 0. When the mother is pregnant, we should already be carrying out parent education, giving all sorts of information to the mother-to-be. So apart from the EDB, the DH can chip in. They can work at the maternity and child health clinics, and also some other units under the LWB can also assist. And also we can also work with the Narcotics Bureau of the Security Bureau in drug prevention work as well. So we agree that we should adopt an integrated approach to boost our support to families. Ms. Kwok asked about our concepts or principles in parent education. I think our principles are very clear. We adopt a parent-oriented approach. We attach importance to the overall or the whole person development of the children. We also pay attention to parents' mental and physical health. So parents are taking part in activities of PTAs, and they will be able to get some information from these activities. The new school year just started in September for, say, P1 and S1 students. You know that at the end of September, we already organized some parents' nights and gatherings, and seminars were also organized for parents, and principals will meet with parents as well. So this is also part of parent education. So we don't necessarily have to work through the PTAs. I still have some time. I would like to raise this. Everybody is concerned about national education, and parents should lead by example. So can we consider that supporting parents going to the mainland to conduct exchanges? And yes, we can consider that. Next one, Mr. Chi Kok-hang, the last one. Thank you, Madam Chair. Recently, I have been talking to primary school and kindergarten principals. They said that the percentage of young parents having negative views and sentiments is rising, and they are exaggerating the setbacks of the schools. They are acting like consumers. They try to maximize their benefits, and they may have some emotional problems and been scolding the children all the time. So schools face difficulties in dealing with such parents. I think it is related to the distorted values within the society. So we must instill positive parenting into parents, and I appreciate the government launching the Positive Parent campaign and also committing a lot of resources to KGs to do parent education. I'm also a registered parent education instructor, and I think we should set clear targets. Some themes are important: empathy, appreciation, management of emotions, and positive parenting, and so on. I believe that there are experts in the government which can help with these works. When you do parent education, would you at the same time be providing quality training to teachers and school principals? And for the experts that you have, would you ask them to consider coming up with strategies to help those parents with a negative mindset or attitude? And also, the government provides a one-off subsidy, and only the charitable bodies are allowed to submit the bids So can you relax the restriction and do away with the criterion of the lowest bidder gets the bid? If you adopt that approach, then some very good training bodies may lose the opportunity to get the job. Secretary, in paragraph 6, we talked about enhancing the capabilities of teachers. We organized certain training for them. We have commissioned a second post-secondary institution to provide a 12-hour short training course to teachers at KGs and primary and secondary schools. We hope to sharpen their skills in mediation and communication with parents. Those who have participated in the courses have given us very positive feedback. We will continue with such work, and that is to enhance the teacher's professional competence. On the Positive Parent Campaign, I'd like to thank the members' recognition of this campaign. I just briefly mentioned that on parent education, we do have a curriculum framework. And for the framework for kindergarten parent education, we have already covered the points raised by the member. And going forward, we would also draft or compile a curriculum framework on parent education for secondary and primary school. Now, I agree with the members saying that we should cultivate a sense of empathy and a sense of appreciation among the parents. And we should also educate students on the same values. So empathy, say, forms part of the value education content. And we have to be... And in our value education, we also have adopted the theme of being positive, be grateful and treasure what we have, stay positive and optimistic. So we try to work with the schools and the families. Now for submission of bids, can you be more flexible? Well, we'll try to review the situation and revert later to the member. So quality should be affected as well. Thank you for attending the meeting. We discussed homeschool cooperation. Parents are very concerned about this. We always talk about winning at the starting line. I have taught in the university for 30 years, and a lot of students say win at the starting line, but they lose at the finish line because there is a sort of overboosting. So every time when I do a lecture, I would warn people to avoid that, winning at the starting line and losing at the finish line. And that is why early childhood education is really important. So we should instill positive values into children. We should try to identify the real interest of our students. We have seen many students getting very good results in secondary school, but ultimately they end up in a different profession from what is planned at the beginning. So I thank the Undersecretary for coming, and when we later discuss the decline in population, so please give us more views so that we know how to tackle the problem facing the education sector today. Thank you.